Welcome to Gutsy Talks. I'm Rachel Larson, your host, naturopath and nutritionist, and I'm here to have real, honest conversations that can help you heal your gut, calm your mind, and fall back in love with food. Together with leading health experts, we'll dive into all things gut health and explore the deep connections between your gut and overall well-being, so you can feel empowered to take control of your health and live your best life. If you love all things gut health, follow me for more on Instagram at rachel.larson or head to rachellarson.com.au. Now, let's get into today's episode. Today, we're joined by Tanya Wells, owner and director of Melbourne Integrative Oncology Group, MIOG, and a leading integrative oncology naturopath with over 20 years of experience. Tanya is a naturopath, nutritionist, herbalist, and hyperbaric oxygen therapy technician with a deep passion for oncology research, having recently commenced a master's by research in oncology. At MIOG, Tanya and her team provide evidence-based complementary care tailored to each patient's unique needs, helping to reduce treatment side effects, improve outcomes, and support overall well-being before, during, and after treatment. So get ready for an insightful insight. And here we are. Welcome, Tanya.
Thank you, Rachel. That's very nice.
Yeah, look, I have to sing your praises. And for listeners who don't know, Tanya was my lecturer many years ago when I was studying. And I remember me and my friends back in the day being in absolute awe of you as a lecturer and just your wealth of knowledge. Yeah, it was absolutely like we love you were probably the standout lecturer that we had. So to have you here and to be having this conversation, I'm really excited for.
That's nice. Thank you.
So tell us, Tanya. So today we're going to be talking about integrative care in the field of oncology. What really has taken you to, I guess, be in this niche of oncology integrative care?
I think I've always been science related. So I did a science degree before I became a naturopath and also studied in the medical field. So it's like, you work yourself out as you kind of get older and work out what's appropriate for you and what you want to do with your life. It takes time, but certainly I've definitely been touched by cancer in a lot of ways, and that's led me down to working in a field that is supporting patients when they're at their most vulnerable. That's really important to me.
Yeah.
And also, I really enjoy finding solutions to hard topics. I do enjoy, as a practitioner and as a person, to just try to problem solve things. I'm really keen to fill those gaps and problem solve things for patients. So within my team, I tend to do most of the rare cancers and the kids and all the complex things. So it is something that I really find rewarding to be able to do that. It's a very rewarding job.
Oh, I can only imagine. And yeah, you've clearly chosen the field if you like a challenge. Like you've probably picked the field to be in. As a naturopath, it is a field that I hold in high regard, but also in totally kind of fearful of it, knowing as I say, someone that if any patient were to come to me, because I understand that there is so much to know about it and there's so many complexities and nuances that you actually really need practitioners and clinics that have this as their niche and their specialty, which I know that we'll get into all the nitty gritty and what that looks like. But yeah, it's just amazing that you've gone into this field. It's much needed. And you spoke before about, that you've been touched in many ways, by people having cancer. And I think that goes for kind of everybody living in today's age. Like, what are the statistics in terms of how many people are affected by cancer?
I'm not really sure about the whole statistics as far as, how many people overall. I think the most recent data I've got says it's like 150,000, something like that, new cancer cases every year.
In Australia?
In Australia,
Yeah,
yeah.
yeah. Wow.
So there's certainly many patients that are affected by cancer. Sometimes it's very early stage, and there are some types of cancer where there are more and more people being caught at that early stage. We've got better detection and better screening, and people getting caught very early, which is awesome.
Yeah.
But there's still a considerable amount of people who don't get a diagnosis until they've got a very advanced situation, and then it becomes really tough.
Yeah, absolutely. And, there are so many differences in cancers and, they don't always have these obvious symptoms. They could be as common as fatigue. And you could literally say fatigue could be from any source, iron, stress, sleep can go unnoticed. You mentioned before about like, statistics. There's so many depending on what cancer we're talking about and what demographic and then that type of thing. But one thing I wanted to mention was, I guess, bowel cancer specifically and how that seems to be on the rise for young people. And I wanted to get your thoughts as to why that is and what's going
Yeah.
on.
Yes, I think you were thinking of the recent health data that quoted that there's been a 266% increase in bowel cancer in the 15 to 24 age range.
Yeah.
And that is true. I mean, as far as, those diagnoses, I don't have any new data, but I do know that, say, 1984 to 1988, there was like 3,500 patients in that age group. And in 2014, 2018, it was like 5,300.
Mm,
I'm not sure about the last few years, but certainly if it's gone up again, then yes. It certainly has increased quite a bit. And as much as if we actually look around other age groups as well, there are other age groups in which the incidence of cancer is also increasing
mm,
for different types of cancer. And, each of those age ranges has a different type of cancer that sort of presents the most in kids and children. It's often leukemias and, young adults in that age range that we're talking about, the 15 to 24. It's often more around the sort of Hodgkin's lymphoma, some melanomas, testicular cancer in males. But certainly as we get into the adults, that's when we're looking at things like breast cancer and lung and bowel.
mm.
And certainly there's typical cancers of the older demographic. So there's some of those that are actually also increasing in incidence, and we're still trying to work that out.
Yeah, I was going to say, is there anything that you're seeing in the research that gives you, again, it's hard to say this one thing given we're talking about different ages, different cancers, but if you can give any specifics, if there's anything in the research that you're saying we're finding an association with this different risk factor with an increased risk of developing something, is there anything like that out there?
It's a tough thing to answer
Yeah,
because, there's this perspective in healthcare and in general, if I'm going onto TikTok and having a look at what everybody says causes
yeah,
cancer,
yep.
there's this perception that there's a one size fits all perspective, and
Mm,
that's absolutely wrong on every level.
yep.
Okay. So here's the anti-cancer diet. Here's the cause of cancer. Here's this. That's actually rubbish. I'm just going to say that over and over again. That is rubbish.
Mhm.
There is no one thing because every different cancer diagnosis, every type of cancer cell, whether it's brain or breast or bowel or lung or wherever, hematological, they all have different drivers of growth. They all have a different preferred fuel source.
Mm,
So, if we're looking at the, websites and practitioners who say everybody should be on a ketogenic diet. Okay, well,
yeah.
yeah, if you've got a brain tumor, then yes,
Yeah.
ketogenic diet is most appropriate.
Mm,
But then, that's because that particular type of cancer cell is driven by glucose as a main growth promotant. Whereas if we look at hematological cancers, it's actually the opposite.
wow.
Those particular cells love fat. So, we're not going to be recommending a ketogenic diet for someone who's got a hematological cancer. So it's like there's so much misinformation out there. It's
There is.
very, very hard to actually work out what's what when you're navigating this space as a person in the
Mm.
world. And even as a practitioner, it's hard to find good research that's worth reading. So there's no one size fits all. That's my first thing to say.
And I hope that we say that again and again and again because I think, that is often what, I mean, we all see it is that this is the anti, this is the most, everyone has to take this. And I actually remember, I don't know if it was a talk or a webinar, I remember you giving that example of, ketogenic diet's great for this, not for that. And I was just thinking, there is no way the general public would know about this.
Mm.
As practitioners, even myself, I don't work in cancer, so I'm not up to date on that. But like, I don't know the degree of intricacies that we need to be individualizing our treatments. Like it goes to show that there's a high amount of research and complexity that goes into careful and considered treatment and support for these areas.
Mm.
So I guess this question also might be one of those things where like I can't answer it because it, again, for what we're saying, it's completely individualized, different cancers, but genetic versus lifestyle, are they just as important as each other? Is the lifestyle more important than the genetics? Does it depend on the type of cancer? Because I think, I guess for some cancers, there's more research behind it. I think of the different BRCA genes for breast cancer and no. So yeah, how important is either? Are they kind of working together in terms of how if cancer gets expressed or not?
Yeah, it's a good question. It's a question I get asked a lot.
Mm,
It depends on the type of cancer and the age group that you're referring to. If we're sort of focusing mostly on sort of bowel cancers in the 15 to 24 age group, then it used to be that I remember 20 years ago, the only person that I would see diagnosed with bowel cancer in that age group was someone who had a condition called Lynch syndrome
mm,
or who had FAP, which is just familial adenomatous polyps. So it's just like a familial or genetic tendency to create lots of bowel polyps. And there's another condition called Lynch syndrome, which is a genetic condition where your body doesn't has got mutations in the repair genes that
mm,
support sort of making sure that any dodgy cells are being repaired appropriately. So, 20 years ago, it used to be that the only people I would see having bowel cancer in that age range were people who had those conditions. That's not the case anymore. So, I mean, there's a lot we know and there's a lot we don't know
mm,
about why that happens. There are some conditions that are very much genetically related, and we're getting a lot better at doing genetic testing.
mm.
So genetic testing used to be out of range for most people because it would be costing 20 grand to
Yeah,
even just get the very basics of testing. Now it's more available mostly. It's still expensive, but
yeah.
it's much more widely available and it's being done a lot more in hospitals too. So we're learning as we go.
Mm,
But if we're sort of talking about young people, young people getting cancer, yeah, there are still those genetic tendencies. There are still sort of hereditary conditions that can increase risk.
yeah,
Most people who have inherited conditions, if it's something that they're known that they're born with, they're being monitored through their life, right?
yeah.
So if you're born with something that your parent also had or something like that, and it affected them so that you get tested when you're a baby,
Yeah,
if you know that that's present, then that's something that can be monitored over time.
yeah.
But if it's something new, that's when we have to go, what else is going on here? Now, I have noticed that there are more and more people who are not diagnosed with FAP or Lynch syndrome that are presenting with bowel cancer in that age range. And that's
Mm,
when we have to go, okay, so what else is going on here? And it's interesting because actually, just today, I saw an article that came out that looked at what are the sort of main predictive factors in determining whether someone under 45 is going to get bowel cancer.
mm,
And so that's a big age group and up to 45.
yeah.
But it's basically whether you've got a family history, if you are obese, if you smoke, and what sex you are. So obviously males more than females. But certainly if we look at everything else, there's a few things that I've noticed that are coming up in the research, but we're still learning about them.
Mm,
So these are things that we already know. I'm not going to tell you anything other than what is very well known out here.
yeah.
But some of the main factors, if I was to say, okay, in the 15 to 24 age group, what do I see the patients in my clinic
Hmm.
who are presenting with that condition and what are some themes here? Definitely it would be sedentary lifestyle. So
Yeah.
having a sedentary lifestyle is very much a feature of all cancers, but particularly ones where we're in that category that lifestyle definitely does impact
Hmm.
whether you get that cancer. So sedentary, definitely behavior. The next is a diet very high in processed foods.
Yep.
Okay. So processed foods are easy, they're everywhere, or refined foods, we would call them, right? So we've got refined foods. And so that's number two, a diet high in refined foods. Number three would be obesity, definitely.
Mm,
So, or anywhere where someone's, got too much fat versus muscle mass, where we've got a little bit of obesity there, central obesity in particular.
yeah.
And then we've also got things like, so that's what I would say the most
Mm,
smoking.
mm.
Smoking is like key, especially vaping.
I
Oh
was
my
going
God.
to say, is there any change in the data? Is it just as, in terms of the vaping? I mean, they're both clearly horrendous for you. Are you seeing that smoking, vaping, that it's all lumped in the same, big risk for cancer kind of stuff?
Yeah, when you're talking about what does the data say,
Mm.
data is always 5 or 10 years behind
Yeah,
what
yeah,
is happening.
yeah.
So because vaping is new,
Hmm.
it's really been over the last 5 years that people have been vaping. We don't have that data yet. But in an everyday, kind of life, we're seeing vaping is just so much worse. It's so much worse. It's so
Mm,
much stronger than normal cigarette smoking. It is incredibly bad for you. It's something that no one should ever start.
mm,
You do start it, then you need to stop doing that because the health complications are not just for sort of lung problems. We are seeing people present to the emergency department with acute problems associated with
mm,
vaping.
mm.
And the problem is the overdose reactions can happen quite suddenly.
Yeah.
So that's what's being seen in the emergency department. But for me, yeah, I'm definitely seeing that as being a contributing factor.
Yeah, I mean, I think like what you said, what you're mentioning here about the risk factors, there's nothing that is like just out of this world new, but this is what we need to hear. We need to hear that it's like these are really basic, well-known risk factors that we can work, that we can be more active. We
Mm.
can make better food choices. Of course, there's a whole other conversation about education and access to all these things, but these are things that we know, and just getting those basics right is something that people can do to hopefully reduce their risks in different ways.
Yeah. Even just on food, I just want to mention something
Yeah,
else. It's not all about that lifestyle too. So there's some other things that are impacting that age range. Okay.
yeah.
So, we know that there are some environmental toxins, infections, even like little kids getting things like Helicobacter pylori, that's
Mm,
also relevant. Kids getting Helicobacter, and then that can contribute to just chronic inflammation in the gut, and then
mm,
that leads to problems down the track. There's other things too, that are being investigated that we don't know yet the impact.
mm.
Things like the impact of the microbiome, of course, which is a huge part of how our gut functions and our immune system.
Yep.
It's like microplastics, that's all being investigated right now to determine, you know, how much of an impact is that having in this age group, and certainly on the likelihood of that. The other
Mm,
thing that I notice with this age group is um, particularly poor at screening and going to the doctor to
yeah.
get investigations. So,
Mm,
fobbing it off as being something else,
yep.
or I mean, we all do that. We've all got a life where it's like, oh, I'm tired because of,
Yes.
50 things I could justify tiredness with.
Yeah.
Or maybe I could go and get this checked out. So I've got this 2 week rule for myself, and that's a good rule that I tell people is that if you've got a symptom for 2 weeks, that's when it's time to actually go and get it checked, because having something for 2 weeks that doesn't resolve, or it gets worse, or it just, say for example, in the gut, if we've
Mm,
got some sort of gut infection, within 2 weeks it should be changing, improving.
yeah.
Whereas if it's not improving, that's when you're like, I think I might go and get this checked out, or go and do
Mm,
a fecal test, or I'll have an examination, or I'll get something checked.
yeah.
So again, young people tend to be less likely to go and get routine examinations and all of that kind of stuff. So there's a lot. There's a lot.
I think that is something that we need to highlight. And the idea of a 2 week rule is a great rule. Like I've never actually phrased it like that, just because again, you're like, I'll get over it. But then you have to draw the line somewhere. I think 2 weeks is a really sensible kind of place a, that boundary for yourself. Right, go get it checked out, see what
Yeah.
happens. For people who, I guess my question's more about advocating for your health, especially, I guess, bring it back to a specific example that is bowel cancer in younger people. How do people advocate for themselves in this space, given that it is traditionally seen in the later generations? What can people do to help them get the care and the screening and the testing that they need?
So in the current medical model, it is very common to have a delayed time frame in which you're getting investigations done.
Mhm.
So I guess the first step though is to have good self-awareness, to
Mhm.
have an awareness of what is normal in your body generally.
Yep.
Okay. So for women, you know that that fluctuates over the course of our menstrual cycle if we're having a menstrual cycle. But certainly if you've got good awareness about what your body's regular function is like, then you're going to have good awareness about what's not right.
Yep.
Now, you don't have to have a health degree to determine what's not right. It is when your body is doing something that's not quite right, then you need to be assertive
Mm.
and be self-advocating. So the first thing is, that 2 week rule. So if I've got some symptom, fatigue is another thing. That's a whole nother thing entirely. But let's say we've got a symptom in the gut and, how long will you have that for? Two
Yep.
weeks. You'll deal with it for 2 weeks, do the things that you know are helpful for that period of time and see what happens. If at the end of that 2 week period you still have that symptom, then you go and see your GP. And say, this is not normal for me. Okay, I've been monitoring my body. I'm aware of how my body normally functions. This is not
Mm.
normal for my body. And if you have to repeat that phrase, then you repeat that phrase. Okay.
Mm.
So often a medical practitioner will really listen to you if you repeat something
Mm.
over and over again. So if you feel like you're being dismissed or not being taken seriously, which does happen in the younger age group,
Yeah.
then it's important to repeat what you're saying
Mm.
until they're like, oh, wait a minute, this person said this 3 times. It
Yeah.
must be very important to them.
Yeah.
And so, and also they might say, oh, you just got a bug somewhere. It's like, well, do you have a bug? Have you eaten out anywhere? Have you had gastro? Have you, if all of those sort of regular things, have you had unwashed alfalfa? Have you, whatever it might be that are the known things that can cause gastro, if none of those things apply, then you can say none of those things are relevant.
Yeah.
It's always good to take someone with you who can
Mm.
advocate on your behalf too. If you feel that in that environment, it just triggers
Yeah.
anxiety, or if you feel overwhelmed in that environment, then take someone with you who can also advocate on your behalf.
Yeah.
But go in with a list. So people who get the best outcomes with regards to going in to see their medical professional are people who go in with a list and stick to that list.
Mm.
These are the things that are going on for me. This is what I want to see investigated. And if they say, we're not going to do that now, I'm not going to give you a referral, and I say, okay, well, I'm going to come back in a week if I still have the symptoms and I'd
Mm.
like a referral then.
Mm. Mm.
So you can say, I'd like a referral then. I'll
Yeah.
come back in a week.
Yeah.
And so that's where being assertive is very important. I used to put medical professionals up on this crazy pedestal that they were so much better than me. And I mean, this is before I was a practitioner, and even when I was a practitioner at the beginning. But still, they're just humans who are
Yeah.
just as overwhelmed as you. They don't have all the answers. They don't know you and your body.
Mm.
So going in there and saying, this is what I want is
Mm.
sometimes easier. Now, that requires quite a bit of health literacy, which I understand is not necessarily um,
Not everyone has that.
what everyone has. That's
Yeah.
right. But still, if you know that there is something not right in your body,
Yeah.
repeat until you get some investigations.
Yeah. I think that is the most sound advice, especially the tips about having someone with you and the list, because health, as you said, it can trigger all sorts of emotions. You can be crying, you can go completely off tangent, you can shut down, all these different scenarios where you just kind of leave a room without actually having discussed what you were there for, or only partly. So I guess for anyone that's exploring any health condition, that's a fantastic set of rules and guidelines to go by. Let's move on to how integrative care actually works. I know we get called alternative and holistic medicines, and it feels like it's a bit of an either or scenario when it comes to the world of cancer. So, can we please clear up what I guess a role of an alternate health practitioner looks like?
Yeah, sure. So I'm not an alternative medicine practitioner.
Mhm.
I am an integrative medicine practitioner. I don't offer alternative medicine.
Mhm.
So I'll just sort of give a little highlight there, and what that means, little
Yeah.
definition.
Mhm.
So integrative medicine is where you are incorporating evidence-based complementary therapies with evidence-based medical therapies
Mhm.
in order to get the best outcome. Okay. And what I mean by the best outcome, there's evidence that shows that incorporating evidence-based treatments enables better outcomes.
Mhm.
So you get uh, better outcomes with regard in an oncology setting. You are more likely to have a cure than not cure.
Mhm.
You're more likely to get more cancer cells killed than less cancer cells killed.
Mm.
So it can also reduce side effects without interfering with the treatment itself. We've also got, independent anti-cancer activities that can be incorporated there, and any other kind of support, mental health support and other system support.
Mm.
So this is where you are incorporating the best of both worlds into a treatment plan. And people will always get better outcomes that way.
Mm.
Using just evidence-based medical interventions is great. That's going to give you a certain amount, but it's not going to fix everything 100% of the time and give no chance of recurrence. Alternative medicine is not going to do that either. So alternative medicine is the use of any practice that's meant to be used instead of a medical intervention or an integrative intervention.
Mm.
So typically alternative medicines don't have that sort of evidence base to be able to support them,
Yeah.
and in some circumstances can be very dangerous.
Mm. I think the word that I just kept coming to my head when you were talking about the integrative approach is just the word like a synergy. It's kind of like helping each other really get the patient the best results and hopefully support their quality of life throughout that journey, their journey and beyond. So what does it, I guess like again, every person is different, every cancer is different, but for someone that's like, yeah, but what does it actually mean to take an integrative approach to my cancer? Like, what does that look like? What kind of practitioners could be involved in that integrative care? And again, when we're talking, this is, particularly in your clinic, you have uh, practitioners who are trained in that integrative space. So this, I want to talk, I guess, about practitioners that are specific in their integrative ability, not just any blow Joe practitioner that gets off the street. So what does it look like, an integrative model of care?
Mm. So this clinic is based on an integrative care model that I experienced working overseas. So I've worked in clinics in Germany and Japan, and in those spaces, it's a real collaborative model.
Mm.
I think as a health practitioner, we grow up thinking that we're going to be these independent entities, or certainly in complementary medicine. I definitely remember when I was a student having a lecturer say to me that we're all competitors and you've got to like outcompete everybody. It was just
Oh
like this
gosh.
scary place where we're not meant to be collaborative on any level.
No.
Whereas I run a clinic that's very collaborative. We're sharing information and all contributing to, our research database. So the way it can look, in my space here is where, a patient comes in with a particular diagnosis. If it's something that's complex, we do take it to our multidiscipline meetings, which we have. Otherwise, we'll use the research database that we've developed over the last 25 years to come up with an integrative plan for that person. So
Mm.
it's an individualized plan. So we do all support as an individualized written document. Now, there's some things that, are general recommendations for people with a particular diagnosis of cancer, but even then, there's a lot of things that need to be tailored for that person. Every person's different. If I've got 10, 20-year-olds with bowel cancer in front of me, I'm not going to be prescribing them the same thing. There
Yeah.
are some things that will be similar themes, but every person needs to be tailored. And so
Mm.
that usually includes maybe some herbs, maybe some nutritional supplements, acupuncture where appropriate. So it depends on their treatment, whether they have acupuncture or not. There's going to be physical therapies, lymphatic drainage if they're pre and post surgery. And at other times as well, there's going to be other physical therapies, compression therapy, sauna. And of course, we do hyperbaric therapy, and we do that particularly around pre and post operative support, post operative. And certainly, there's some research that shows that hyperbaric therapy can be helpful in improving outcomes with treatment too. So it's sort of like there's a whole lot of options that are available for
Mm.
patients.
Mm.
Most of my patients are not within the area that my clinic is in, so they don't necessarily get to come here, but we'll make those recommendations for when and how frequently they should have acupuncture, when and how frequently they should have lymphatic drainage or whatever it might be.
Yeah. Wow. I mean, I that is individualized prescriptions, like at its best, really like taking in all of the different things somebody could do and making it specific to that person, their specific cancer, age, all of those types of things. Talk to me about, so you mentioned before some of the benefits. Is there any data or any clinical experience that you've had where, you've seen someone kind of have reduced symptoms or reduced side effects where you just thought, this is amazing? Like I don't know, like, are there any things where you just think, wow, like I'm so proud to be helping this person feel better during this very challenging journey?
That happens to me every day, which is great. And just FYI, we don't use the word journey because that's something that most patients with cancer hate that phrase. So
We'll
just
take it out
say
of the dialogue. No more. We won't say
no more
that.
journeys. Um, throughout a patient's experience or
We
a
say that.
trajectory, sometimes we say that. Sounds a bit like you're on your way up.
Yes.
So during our patient's experience with cancer, we do
Mm.
have a lot of opportunity to actually support them in different ways. So,
Mm.
if I'm looking at a timeline of a patient's experience, it might be, we've got all the stuff around the initial diagnosis.
Mm.
There's a lot of discussion around treatment and what they want to do and, that kind of decision-making space. Then there's also, their treatment itself. So it might be surgery, in which case we would do a pre and post-operative support. Certainly someone who's having surgery for colorectal cancer, if we do pre and post-operative support, that significantly reduces the risk of infections that can happen during and post-operatively. So that's really helpful. Also, having the hyperbaric afterwards just accelerates your repair processes in the body. Then when someone starts to go through, say, chemo or immunotherapy, there'll be certain treatments during that time that we'll recommend in order to reduce side effects. And sometimes those can be pretty amazing. There's a
Mm.
particular group of chemotherapies that causes a condition called neuropathy, peripheral neuropathy, where you
Mm.
can get tingling and numbness in the hands and feet in particular. Now, if we don't prevent that, it becomes a permanent thing, which is a real problem. It can stop you
Yeah.
from being able to walk and drive and all sorts of things in the future. So
Mhm.
that is one of the things that comes to mind, that natural medicine is really great at preventing.
Mm.
And certainly over the last few years, we've developed our own little triangle of therapies that we use to prevent that condition. And that's one of those
Wow.
things that I feel really great about, that we can absolutely intervene there and stop that from happening. There's other things too that can be supported during chemotherapy or immunotherapy. And then, of course, there's long-term stuff. So, many people, even though when we think about people going through treatment for cancer, we might think about just those early stages. You think about the person with breast cancer who's had,
Mm.
their initial surgery and chemo, and that's it seems. That's actually not it.
Mhm.
They've got a lifetime of intervention or, long-term preventative care that's being offered by the medical model. And we
Yeah.
need to support them to reduce those side effects and support outcomes in the long term as well. So it's not just about what's
Yeah.
happening sort of acutely. It's
Yes.
more around, how can we improve your life moving forward? I mean, I had a
Mm.
conversation this morning with the mother of a 2-year-old with leukemia. And so we were talking through his support plan. And, the support plan that I've written for him, it's not just about the treatment that he's going through now. It's
Yeah.
about how can we support him now so that when he's an adult survivor of childhood cancer, he's going to have good brain function, heart function,
Yeah.
fertility, all of these other things, and not get another cancer from his treatment. So, I'm focusing on that now. It's the same for
Yes.
anyone. Yes, there's certainly things that we're going to focus on when they're in their treatment, but also
Yeah.
still in the back of our mind, we've still got to have that sort of preventative care initiated quite
Mm.
early.
Wow. And like, as you said, you get that, you've got literally daily examples you could have pulled on of people uh, experiencing something different than what they think that has to be a part of their experience, such as neuropathy. Like there is, to have that not be something that they have to then worry about for potentially the rest of their life, like what a weight to have off their shoulders. Now, like, is there much pushback in terms of patients wanting to have an integrative approach with doctors and specialists? Like, how does that work? Because just even from my perspective, where I'm dealing with gut issues, there's sometimes a bit of a, you know, it can be difficult to sometimes have a collaborative approach with even GPs and naturopaths when we're looking at IBS. How does that look for patients? And I'm just, I guess, more angling it to be like, how do we get around that if there's any resistance to their patients wanting that integrated approach?
Mm. There's a lot of resistance. And I mean, I
Mm.
guess I have noticed improvement over the last 25 years, thankfully. But
Yay.
still, it's still got a ways to go. And it depends. I think if it's someone who I've worked with before, they will be aware that we're not doing anything stupid. So they'll know
Yep.
that. And I say that, pretty bluntly because lots of health practitioners do stupid things,
Yep.
make recommendations that they shouldn't be making, which are outside their
Hmm.
scope of practice. And
Hmm.
we do need to be mindful of ensuring that we're really using evidence-based medicine and supporting that individual patient, not,
Yeah.
extrapolating from something that shouldn't be applied. It's difficult on a number of levels. So
Mm.
just to give a bit of a sort of summary around that,
Mm.
there's a real sort of spectrum. There's some health practitioners and medical oncologists that just don't really care what people do outside of it, or they're sick of hearing it, or whatever it might be. So they're just like, whatever. And
Yep.
then there's the trajectory in between where, there's people who are concerned or cautious, but not all that worried. And then there's the people at the other end of the spectrum that are just anti everything, anti anything. So,
Mm.
even though we know that that's actually not an evidence-based approach. So now there is so much published medical data in the medical journals that shows that integrative medicine is appropriate in certain circumstances, that having that, oh, nothing should be taken ever is not an approach that's evidence-based in most circumstances. There are some situations in which you wouldn't apply any natural medicine,
Mm.
like if someone's having a stem cell transplant, you're not going to give them
Mm.
anything during that. But there's, in the most part, regular treatment, there's an opportunity to do integrative care. Even if it's
Yeah.
just, I'm going to do fasting around my chemotherapy.
Yeah.
Fasting around chemo has been shown to reduce side effects and improve outcomes. Well, that's a non-drug therapy, non-drug something that, you can do yourself. But
Mm.
so that's one part of it. There's personal perspective. The
Yeah.
second part is most medical oncologists wouldn't have a clue about interactions between natural medicine and mainstream treatments. So
Yeah.
the thing is that they often say, we'll check it with a pharmacist. Now,
Yeah.
hospital pharmacists will use one of two databases, the Natural Medicines database or the Memorial Sloan Kettering database. Now, they are great, but they are also, unfortunately, chronically outdated. They cannot keep up
Mm.
with the research. They are also utilizing, like they include all research, even just test tube research or things that aren't
Yeah.
necessarily relevant in the human body.
Yeah.
So, and they're also legally obliged to make recommendations based on those two databases. So even if
Yeah.
I can say, hey, here's this great research article that's been published in this medical journal that shows that this natural medicine will actually help this patient, they may
Mm.
not be able to okay it because of medico-legal reasons.
Yeah.
So
Yeah.
most of the time, it's up to the patient being self-advocating and making the
Mm.
decision on their own. So it's
Mm.
about them saying, okay, well, I understand your perspective, medical system, and I understand, MyOG's perspective of showing me the research. I'm going to make my decision as a self-advocating patient and decide whether or not I'm going to do these things. We can
Yeah.
also sometimes negotiate. So there are some hospitals or practitioners where they might come back and say, no, I don't want you to do anything. So we'll be like, okay, let's work out a deal. We'll take
Yeah.
these things in between treatments so
Yeah.
that there's no risk of interaction, or at a different time of day if it's not going to interact that way, or let's pick and choose these things and not these things. So there's always room for negotiation, but I think
Mm.
if you've got someone who's just like all or nothing, that's when it's also time to consider whether that person's right for you. You've got to make sure that you've got a medical professional who actually matches your ethical
Yeah.
value system. It's got
Yeah.
to be someone who at least respects you and your values.
Yeah. I think team care approach, it's a while obviously people have to be strong in their own fields and what they're bringing to the table. They have to play together to some degree, otherwise it's not really a team. So I think that's a really good point as well, as just kind of checking in to see, hey, is this the right practitioner for me?
I go to a lot of medical conferences, right? So I
Yeah.
can't remember the last natural medicine conference I went to, but I go to a lot of medical conferences every year because, I'm wanting to see what's coming up and I also want to talk to people.
Mm.
And it is very interesting that in every single medical conference that I ever go to, there are multidiscipline presentations talking about having a patient-centered care approach. That's the phrase, patient-centered care.
Yeah.
So if we
Yeah.
really are genuinely doing patient-centered care, then there's got to be an opportunity to communicate. So I do write referral letters to certain medical professionals, and I've got a few interventional radiotherapists that I refer to that think outside and work outside the square. There's always people that we can refer patients to if they're not happy with their current practitioner. But certainly
Yeah.
communication is important. And it's
Yes.
only in the last few years that I've actually had joint consultations with the patient and their medical oncologist as well. That's happened a few times. So
Wow.
it's like, we're moving in the right direction mostly, but when if so for me, if I seek to speak to a medical professional on behalf of the patient because they've asked me to, but they
Yep.
don't want to speak to me ever, that's definitely a good lesson in whether that person is interested in patient-centered care.
Yeah. Yeah. That sounds like a challenging dynamic and something that needs to be rethought if or reconsidered if that's not quite the team you want, I guess, in that time in your life.
It's really tough. And there are many patients who, I'll write a wonderful evidence-based plan for them that they've paid good money for. And
Mm,
then it gets trashed by their health professional and then they don't do it, which is really sad because I know that from my experience in clinic and from the research that that person would get benefit from that. So it's
absolutely. Are there any types of cancer or types of treatment which integrative care isn't appropriate?
yes, there are definitely. There's certainly situations in which we wouldn't give any natural medicines for a particular period. Like I just said, stem cell transplant's probably the most important one.
Mm,
There are some other situations. There's also situations where we just don't have the research. Okay.
yep,
So
yep,
from a research perspective, if someone comes in to see me and they're on chemotherapy and these often chemotherapies have been around for a long time, which means there's been a lot of opportunity to do research on integrative medicine.
yep,
And if there's plenty of research and I can say, look, here's some great studies that show benefit if we combine these things, that's great. But if someone's on a new medication, then if they're in a clinical trial,
yep,
sometimes we can't give anything because I can't determine that it's safe for that
yes,
person to take that. Theoretically, we can say, look, oh, well, theoretically, the drug works like this and the natural medicine works like this. So theoretically, they should be okay together. But if there's not enough evidence of safety, then we're not going
yep.
to recommend those things. Even if there's evidence of benefit, if there's no evidence of safety or minimal evidence of safety, or not enough for my liking, then I won't
Yeah.
prescribe that.
Yeah. There's, as you said, it's an evidence-based
Mm.
driven care that you're given. So it needs to be up to scratch. Otherwise, there's just not the evidence there to say that with confidence and to, I guess, have that patient, have their safety and their outcomes. Like that's the thing that you're working towards and wanting for them. So that's just what it has to be kept front of mind.
Mm.
Okay, there's three things I want to ask you about, whether it be personal opinion or what the evidence says, things I think we hear about when it comes to cancer. But the first one is antioxidants. I think there's a bit of confusion. Are they good? Are they bad? Talk to me about antioxidants and cancer.
So antioxidants are not all in the one bucket. So it's something that we kind of have to break down a little bit. So a lot of original research, I'm talking back in the like 80s and 90s, talked about how we shouldn't have antioxidants during treatment, if you're
Hmm.
talking about that.
Yep.
So antioxidants promote the healing process and they reduce damage to cells and they're very, very important to maintain health. So all of us should be, if we don't have not in current treatment, we should be having a diet rich in antioxidants, rich in lots of color. I mean, most of the antioxidants are in the pigments of foods, so we want nice bright rainbow foods.
Purples and
Yeah,
reds and all that kind of stuff.
right.
Yeah.
And so we want to make sure that we've got lots of color in our diet. That's
Mm,
where we get our antioxidants from. And so what they do is they make sure that as our cells are copy pasting and replacing themselves, that they're doing it accurately. So if we've got a low
mm,
level of antioxidants, then we're going to get more dodgy cells being produced on an everyday basis. During
mm.
treatment, if you've got something that promotes the healing process and you're giving a treatment that's trying to destroy that cell, like radiation,
Yep.
you might not be giving antioxidants, high dose certain antioxidants at the same time that you're giving radiation on the theory
Yeah.
that it might reduce the effectiveness of the radiation. That old research has been debunked in a lot of ways
Hmm.
but it is antioxidant specific. So for example, you can have a vitamin C rich diet, but you may not have IV vitamin C on the day that you have
Yes.
radiotherapy. You
Yeah.
might have it 3 or 4 days later, but you may not have it on the same day. But
Mm,
because the vitamin C is going to allow cells to recover and repair, whereas the radiation is trying to kill those cells. So
yeah.
that's the theory behind that. There are some
Yeah.
things that we won't have at that same time, but sort of saying all antioxidants shouldn't be taken with treatment is wrong. There's plenty of
Yep.
research that shows that antioxidants work in different pathways in the body. So they're not all working. If it's not in the same pathway that the drug is working, then there's not necessarily an interaction.
Mm.
So it's very specific. You can't put everything in the same bucket. But most of the time, when you're in between treatments or when you're recovering from treatment, you definitely want a good antioxidant-rich diet. IV therapies are a different thing altogether, but that requires a consultation.
Look, I mean, that's really the biggest message here is that there is no such thing as blanket statements or answers or treatments when we come to any of this stuff. Like, as you said, all antioxidants aren't, it's not one antioxidant. There's all the different types and all the different pathways that they work on. So, like, I really wanted to get that message across that it's about individualized care and obviously evidence-based care. And this, something that we thought could be really simple, is still not simple. It still requires
Mm.
that. The last thing, which is, I guess, a bit more topical for this time, and it really kind of has nothing to do with the quality of care that you and your team at Myog provide, but the apple cider vinegar TV show, the mention and the use of the Gerson therapy. What are your thoughts on that as someone who clearly practices evidence-based integrative care?
Yes. So I actually haven't watched Apple Cider Vinegar because I lived through the actual thing years ago,
Mm,
and that
yep,
kind of thing just really irritates me. I hate
fair
it.
enough.
So I haven't put myself through that by watching it, but definitely I've had a lot of questions that have come from it.
I bet.
So it actually comes back to the word evidence. Okay.
Hmm.
What is evidence? And there are a lot of different levels of evidence. So let's say I have, I treat myself with Gerson therapy. And just so for people who don't know what that is, it's lots of juices every day. And pretty much all you're having is vegetable juices of different colors throughout the day for a period of time. It's like a version of fasting. Okay. But
Mm.
it's a high antioxidant rich fasting program, basically. In theory, there's no problem with that as a fasting technique, but it's definitely not something that you want to be doing in the long term. But if we
Hmm.
say, well, what's the evidence around that? Well, there's very little evidence around it because there's nothing published. But if we have a look at what is evidence, well, there's evidence that one person's had an experience and got benefit from that.
Yeah.
That experience is individual to that person. It doesn't necessarily mean that it is able to be replicated. So even within the
Yes.
same cancer type, say I'm between 15 and 24 and I've got bowel cancer, I decided to do Gerson therapy and I felt better and my condition didn't worsen, or maybe it got a bit
Mm.
better. That doesn't mean that it's applicable to anyone else in that situation.
Yeah.
That's my evidence of benefit, but it doesn't mean that it'll help other people.
Yeah.
There's a problem in our sort of society at the moment that there's this perspective that all evidence is the same. So an individual person's evidence of benefit is not the same as having real world research where you are either seeing it in a clinical environment again and again and again, or you're
Mm.
doing actual research where you're having several people enroll in a study where you're giving a set amount of something compared to placebo or whatever it might be, and
Yeah.
comparing the outcomes statistically and then publishing that
Yeah.
data. So it's, when I'm talking about evidence-based medicine, I'm talking about published data around that, which means that a lot of things that I get asked about every day in clinic is not evidence-based medicine. I mean, if I think about the things that I've been asked about in the last 24 hours, it
Yep.
is Gerson therapy, prolonged fasting, methylene blue, soursop, all of these things that are
Yeah.
online everywhere at the moment. And people are saying, I've been told I should take this is going to cure me. You know,
Mm.
I've bought some online. How much do I take? all of that kind of stuff. Now, none of those
Yeah.
things actually
Yeah.
have evidence of benefit.
Yeah.
The exception of soursop in women with ovarian cancer, but as far as everything else, no.
Yeah. See that you've just what one person or one type of person, but one type of cancer may have benefit of
Yes.
that one thing compared to the oh gosh, the internet is endless with the things, and especially using the word cure is so dangerous, but it's also so emotive for people when they're dealing with cancer that they are trying to look for these things. So I think having a great degree of caution for anything that you read online obviously needs to be had. That goes without saying,
Yeah.
but
I mean, in the medical system, they don't use the word cure anymore.
no,
Now we use the phrase NED, which stands for no evidence of disease. So that person
hmm
then becomes NED. And what we want to do
yep,
is keep them NED for as long as possible. But
yep,
I guess also when it comes to, as a little tidbit for people who may have an oncology diagnosis and you're navigating this space, which is very hard to navigate. If we're looking and we're saying, okay, is this real evidence or not? What is evidence? Does this sound like it might be true? If you're reading something online and it's creating an emotional response in you, it's not research.
oh, that's
They're going to
good,
try to sell you something at the end of that. And when you're at the end of
yeah,
scrolling or at the end of that video, there's going to be something for sale. And
yeah.
this is where, anything that initiates an emotional response, that's not research. That is some other purpose in presenting that information because real
Marketing.
world research is very boring reading.
Mm,
It's just technical and bland and blunt. It's not like making you go, oh my God, I need this. This is going to help me. If you're having
mm.
that response, it's not research.
Oh, that is a good tip. That is a great
Mm.
tip. And this might be your tip 'cause this I want to end on a question just for it to be, I guess, the most helpful step that someone can take today. So I guess if somebody has cancer looking for an integrative approach or just, I guess, feeling their way out in this space, what would your number one piece of advice be to them?
My number one piece of advice would be do not make treatment decisions based on social media.
Yep, that is sound.
That is my top tip. Other things to do as well, just a few other tidbits, is also just take a moment.
Mhm.
When someone gives you advice or even a practitioner says, you need to do this today or whatever it might be, if there's any element of panic in
Yep.
that moment, or if there's like this urgent pressure to make a
Mm,
decision or to do something, just like take a moment. Just give yourself
mm,
24 hours just to have a think.
mm.
You don't have to make every decision now.
Yeah.
Often in the medical system, if you get a diagnosis like this, you're kind of presented with several big decisions you're meant to make initially and suddenly.
Yeah.
We don't have to make all the decisions now, especially for treatments that aren't going to happen yet anyway.
Yeah.
And even if there is an urgent need to have, unless it's something super urgent that, means it must be done in the next 24 hours. But let's say you've got treatment options. You don't have to make a decision today in that appointment with that practitioner. You
Mm,
can request that they give you the information about the options. You can go home and you can just take a moment. Okay.
mm.
So
Yeah.
many times and also our medical system is completely overrun. It's a terrible scenario that we have at the moment in this post-COVID space. It's just everyone's
Yeah.
burnt out. There's no money, there's no staff. Everything's happening in a more haphazard way than it was before. It's really tough on medical staff. So,
Mm,
it's a very tough environment to work in as a medical professional and nurses and health professionals generally. It's very hard. So
yeah.
sometimes it does feel a bit haphazard or it feels very high pressure to make decisions to get things organized. Just take a moment, just take 24 hours because it's important for you to take the time to make decisions based on how it works for you and your values. So it's
Mm.
always something very important just to take a moment.
I cannot even remember how many amazing points of like just the hacks that you've shared with us today. Like there are just so many. Like I need to go back and kind of write a list for myself, even just to apply it to my patients. But thinking about the 2 week rule, the team care, how to advocate for yourself. Like these are all things that I'm so glad that we spoke about. I was hoping that we touched on them and just it's it's such helpful advice for people to really start acting on right now. Tanya, if people want to work with you or your wonderful, very highly evidence-based team at MyOg, how do they connect with
Yeah,
you?
that's nice. For anyone who's a patient, then they can contact the clinic. We've got a website, myog.com.au, or there's also, you can email the front desk. All of my front desk team are wonderful, absolute
Mm,
gems, and they're all very supportive in enabling, treatment from the right team member. I've got 3 naturopaths here. We're all working on slightly different things, so it depends on what you need. But anyone can come in and have hyperbaric, anyone can come in and have acupuncture or massage. We've got psychologists here too who are
yeah,
experienced in all sorts of complex trauma, not just oncology. So
yeah,
certainly contact the clinic. But it's one of those things that, there's a lot of support out there. There are other practitioners, but it is very hard to try to find someone. I do know that. And just as a side note, if there are any practitioners out there who really want to get into oncology, for all the reasons that you mentioned before, Rachel, that you find it,
too
very,
hard for me.
I need more team members for people to
Yeah,
come and learn from me. The people that work here, they've all
yeah.
had intensive training from me because there's no training anywhere else. So it's sort of like,
Mm,
I definitely need more practitioners on my team to be able to offer these services. So there's
yeah.
something that it's easy enough to have a consultation, and then we work out what's the best sort of integrative support for you at that time.
Oh, I love that. And we will obviously put for anybody listening, both for potential patients or potential practitioners, how to contact Tanya and her team in the show notes. So I just want to thank you again, Tanya. Like, loved it, loved this chat so much. So thank you for taking time out from your busy schedule to come and chat with me today.
No worries at all. My pleasure.
Thanks for tuning into Gutsy Talks. I hope today's episode left you feeling inspired to take the next step in your gut health journey. If you're ready to dive deeper, head over to rachellarson.com.au. There's a range of courses and resources waiting for you. If you loved this episode, I'd be so grateful if you shared it with others who might benefit from this information. And so you don't miss out on future Gutsy Talks, be sure to hit follow and leave a review. I'd love to hear your feedback. I'm Rachel Larson, and I can't wait to connect with you again for our next Gutsy Talk.